biggest thing, and I tell every woman this that I have a chance to talk to, either socially or in a professional setting, I don't ever want women to worry about radiation, particularly regarding mammograms. The amount of radiation you get with a mammogram is less than a hike on a Sunday afternoon, is less than flying out of an airport. I used to live in Colorado, and I said always, I was waiting outside to do a talk, and my forehead got burned. And I said, I've got more radiation now than a woman had having a mammogram or a series of mammograms. And you can imagine if you're doing an x-ray to look at bones, the idea is to blast through all the tissue so that you can only see the bones. Whereas with a mammogram, what you're trying to do is tease out real subtle differences in the densities between these four components of breast tissue that are so very close. So by nature, it's a very low radiation technique in order to tease out those differences. So there's going to be a lot of spots and dots and shadows. You just need to reposition the tissue, look differently. Usually it's okay. So if ever in your life you're called back for extra views from your screening mammogram, I don't want anyone to ever have any alarm about it. We're just being safe. In order to have the right amount of sensitivity. Of that, we're going to pick up about 1 in 1,000 breast cancers. Recently, Nebraska passed a law about breast density, like many states, and I imagine it will soon be a federal law. And it's variable which state, what the requirements are. I think Nebraska has a very reasonable requirement where they just say, in written form, can you just tell the woman she has denser breast tissue? What that means is that it potentially decreases sensitivity. There's two reasons why women with denser breast tissue are slightly more risk for breast cancer. One is because it's denser and can potentially obscure. The other reason, you frankly just have more tissue. Some women have more fatty replaced breast tissue. As you get older, it tends to become more fatty replaced. Women that have more tissue then have more tissue to potentially have an abnormality, which can eventually lead to cancer. The Nebraska law states you should just tell people in written form what your breast density is, and I think that should help provide some assurance as well that if you do get called back for extra views and you know you have denser breast tissue, it's even more likely than anything that you don't have an abnormality. Breast cancer is like it grows in a cup, and the first thing it does is it fills the cup and then it spills over. And when it spills over, it goes regionally around into the lymph nodes. And so when a patient presents with a mass that you're worried about being cancer, the first thing you do is you look at the lymph nodes in the armpit to see if there's a chance it's gone there. If it hasn't gone there, you have a much better likelihood that it has not had a chance to go elsewhere throughout the body. No one has taken away your right to have a mammogram every year and start at age 40. My God, start at age 40, do them every year.